Our next speaker is Dr. Ramya Rajagopalan, who is Assistant Research Scientist at the Institute for Practical Ethics, University of California at San Diego.
I come to the work that we're discussing today and some of the questions that are animating our conversation really from the lens of having worked in this space since my postdoc. I'm sorry, I'm really having problems here. 1 second. Let me. Apologies again. Thank you for your patience. Okay. I'm joining you all from the Center for Empathy and Technology at the University of California, San Diego. And I want to acknowledge that our campus is located on the unceded territory of the Kumeyaay Nation, with the hope that our continual recognition can strive for positive action to redress the continued struggles with legacies of colonialism that members of our community face daily. So I come to the questions that are animating today's discussion from a very cross-disciplinary perspective. My own training and research sit at the intersection of the genome sciences, the sociology of race, and the ethics of technology. And since the beginning of my postdoctoral work, along with mentor and collaborator Joan Fujimura, I've been studying how concepts of race, population, and ancestry circulate in the science of the genome, in the ways that samples are collected and categorized, and the technologies developed to assess the distribution of genetic variation across cohorts, and in the statistical algorithms that are used to analyze and visualize patterns of variation. And one of the reasons that social race has been mobilized to identify populations or ancestry groups in genomic studies is the statistical imperative to control for population stratification when searching for variants related to specific conditions. But in practice, this has meant that race and ethnicity are often used a priori, but misleadingly as proxies for grouping genetic variation. And what this means is that race is often misinterpreted as a proxy for genetic similarity. And I want to argue today that this is an inaccurate application of race categories, as we've heard from many others. This is because there's a lot of scholarly agreement across disciplines, including professional societies in the field of human genetics, that categories and descriptors of race and ethnicity are temporally specific, geographically situated, and dynamic sociopolitical constructs. They gain salience through political norms and societal beliefs about human differences that evolve and change over time. So when census race categories change, as they did in 2000, allowing individuals to select more than one race, the ways and labels and categories available to individuals to choose also expand. And the number of individuals identified as more than one race has gone up by over 25 million just in the last 10 years alone between the 2010 and 20 census. The use of race and ethnic descriptors in genomics research really poses a challenge to understanding these categories as predominantly sociocultural and really interrupts our ability to study the legacies of structural racism that have led to the health disparities we see today. And this is because the genome is widely viewed as unchanging and static. So when associations are made between variants and race descriptors, when these variants are then used to explain the existence of health disparities between different racialized groups, they reinforce a longstanding but incorrect assumption that race and ethnic identities are innate, or that they're biological, or that they're unchangeable facets of human identity. And this endangers efforts to level the playing field when it comes to health equity if we start to locate the source of disparities in genomes, rather than the myriad social and economic injustices that have patterned unequal access to education, employment, and health in the US. So given the dynamism in how individuals themselves self-identify, how can researchers hope to mobilize these terms to study the genome in a standard or scientific way? Self-reported race and ethnicity data are sorely needed, as we've heard already, to document experiences of racism directly tied to historical injustices associated with the use of these terms. But these terms are so fluid and have such complex social interpretations, they're less well equipped to pin down the evolutionary histories of our species. And furthermore, race categories were initially developed as a hierarchy in tandem with violent and oppressive imperial expansion into indigenous lands around the world. How can we strive for health equity in genomics if terms loaded with the weight of colonial legacies structure our analyses of human genomes? Far from being a hypothetical challenge, this has had real consequences in terms of public media and scientific understandings of the nature of race, and for training the next generation of biomedical researchers and health professionals. As Associate Director of Training, Evaluation, and Qualitative Research at the Center for Empathy and Technology here at UCSD, I oversee several educational and research initiatives that bring a lens of justice, equity, inclusion, and compassion to health professional training in genomics and bioethics. And in my work with health professional trainees, I see these misunderstandings about race emerge as students are routinely taught to view race itself as a risk factor for disease. The one race, one disease paradigm underlines preclinical learning about a host of diseases or traits with genetic associations that have long been misunderstood as specific to certain racialized communities, even though new knowledge on these diseases shows how increasingly prevalent they are across diverse backgrounds.
Dr. Rajagopalan, your time is up, just about, so wrap up.
I just want to say very briefly that there are several paths forward that we can take to potentially circumvent some of these current descriptors that are in use. So naming conventions that specify variants, haplotypes, or markers that don't require reference to race, ancestry, geography, or culture. These could accelerate research by focusing translational efforts on specific genetic patterns that individuals have in common, rather than presuming that such patterns exist on the basis of shared racial identity alone. And thank you very much to the committee again for the opportunity to speak.
Great, thank you so much.